Because if they're slouching, they might just compensate by doing like a posterior pelvic tilt or kind of curl this way. So you want to be monitoring for that position. And you're going to instruct them to bring the knee up towards the ceiling as far as they can go. Oh, good. And then come on down. So if she completes the full available range, what grade would that be? 3. Perfect. So if for this muscle, you are going to be testing it more in a mid-range position. So you test to see if she has the full range, and then bring her down a little bit from there. So go ahead and come down slightly. Good. So you're going to hold this position. I'm going to stabilize kind of on the posterior pelvis here to monitor if she's going to tuck into a posterior pelvic tilt, and then resist straight down. Hold it, hold it, hold it. Good, and relax. Now, again, I'm watching for those sort of compensations because from a stability standpoint, you could see she was kind of leaning to the side.
I'm working on it.
Yeah. But I would actually really cue her to try to keep centered for this, to really get a true sense for what her hip flexor strength is. So I want you can go ahead and you can put your hands on the sides just for balance. You don't want them pushing down to keep the stability, but you can at least have them there just for a little bit of support. Now go ahead and lift up to here. Okay, good. Now Jill, let me move you. There we go. Yeah, so with her keeping her trunk straight, you can see we got to that break point much sooner. So I would have graded that about a 4-. So I would say between mid and mod resistance is when she broke, when she wasn't able to compensate with her trunk or hike her hip up. Because what we really want to test with this is your psoas and iliacus strength. All right, so that's hip flexion. Now, what would you guys guess to be the gravity minimized position for hip flexion? Now that we've side lying. Yeah. So side lying position. So go ahead and lay on your side. Okay. So you're going to support the top leg. Okay. And then you're going to have them go ahead and try to bring your knee towards your chest. Good. So if she can go through that full available range in this position, again, I'm not helping her move. I'm just supporting the weight of her leg and then having her go through that full range. That would be your 2. If she can only do partial range of motion in this position, that would be 2-. And then if I palpate, I usually palpate in the inner part of the iliac crest to get a sense for iliacus, and then have her try to bring her knee towards her chest. Yeah, you feel to see, does that hip flexor muscle pop into your hand, and that would be your 1 grade, and 0 for no muscle activity. Okay. And then let's go ahead and do 1 more, and then we'll do a couple more because I don't want to practice multiple ones. So let's sit and we'll do hip internal and external rotation. Okay. So again, these hip internal and external rotators are tested in mid-range, but you want to make sure that the patient can go through their full available active range of motion first. So to test for hip internal rotation, you're going to have them instruct her to bring her ankle out to the side. And you're just kind of monitoring at her pelvis to see if there's any hiking going on. So she goes through a good, a normal amount of range of motion. So she gets a 3 there. Bring her back to the mid-range position. You're gonna stabilize on the distal femur, press on the ankle, and say, don't let me move you. Hold it. 2, 3, good. Okay, so I would give her a 5. So I was able to get to max resistance. Now, were there any compensations? Do you guys know any compensations?
Trunk.
A little bit of her trunk again, right? Yeah, so put your hands down again. Try to keep your trunk stable. Let's do it one more time. Ready? Hold it there. Okay, that was better. Good, good, good. So you just want to be aware again of what's going on proximally as well. And then for external rotators, you're going to have her go through her full available range. So go ahead and bring your ankle in. Good, so she has nice range of motion there. She gets a 3. And then to provide the resistance, I'm gonna stabilize on the distal femur and try to pull her into internal rotation. Hold, 2. Good. Good. And minimal compensation in the trunk, so I would be okay with that. So give that a 5. Okay. And then for gravity minimized for this one, you're gonna have them lay supine. Legs will be straight. So now we take the weight of the leg totally out of the equation, and we just want to see, can she move through internal or external rotation range like this on the table. So if she's able to start in neutral and go all the way into external rotation, she would get a 2. If she's only able to move through partial range, she gets a 2-. And then for palpation for the external rotators, the deep external rotators are hard to palpate, so I typically just palpate along piriformis region and into the glute, and then go ahead and try to bring your leg out. And you're just palpating to see, is there any sort of glute activity there? And then same sort of action for internal rotation as well. Just feeling for that muscle to contract. Okay. All right. So why don't we just practice those?